Every day, approximately 830 women die from preventable causes related to pregnancy and childbirth. For women living in rural and poor communities, maternal mortality is even higher. Almost all of these deaths occurred in low-resource settings, and most could have been prevented. The number of maternal deaths in some areas of the world reflects inequities in access to health services and represents the gap between rich and poor. Why do women die? These women are dying due to complications during and following pregnancy and childbirth, and most are preventable or treatable. Severe bleeding, infections, preeclampsia, unsafe abortion, and complications from delivery are among the major complications that lead to maternal deaths. Poor women in remote areas, like Sierra Leone, for example, are the least likely to receive adequate health care. This could be due to poverty, distance, lack of information, inadequate services, or cultural practices. Here, about 70% of people live in poverty, and life expectancy is among the lowest in the world. In order to improve maternal health, especially in areas like Sierra Leone, the barriers that limit the access for mothers to access quality maternal healthcare services should be identified and addressed on all levels of the healthcare system. With a budget of $50,000, we are going to attempt to do exactly that.
As mentioned previously, Sierra Leone has a very high maternal death rate. To fully understand the reasons why maternal death rates are so high, we decided to take an ethnographic approach and utilize the $50,000 towards an in-depth research program. In this program, we will study the cultures in different parts of the country and understand the role that childbirth and pregnancy play within the culture and society of Sierra Leone. Based on the ethnographic research we compile, we will be able to determine which factors in their healthcare system seem to be the biggest contributor to the high maternal mortality rates. The research will primarily take place in the areas of Sierra Leone that have the highest maternal mortality rates. These may include the poorest villages or even larger cities. Those conducting the ethnographic research in the program will be predominantly women from Sierra Leone. The reason for this is because women who are from Sierra Leone may already have an understanding of the culture, which will help establish a strong connection with the other women of Sierra Leone they are trying to help. Women within the program will be assigned to several areas in Sierra Leone, where they will proceed with their ethnographic research.
Since we have a small budget, we want to utilize our money in the best way possible. After a year or two of research, we will determine which area still has the highest maternal mortality rates and use the rest of the money in that specific area. By investing part of the money in ethnographic research, we will be able to fully understand what problems need to be solved, which will help us to spend the rest of the $50,000 in the most needed areas. This could be going towards transportation, medications, vitamins, or even programs that educate midwives or the women in the villages on how to properly take care of other pregnant women.
Our goal in ending maternal mortality in Sierra Leone is to take the $50,000 budget and put it toward bringing people into the country and asking the villagers what they need. We are unsure as to what they need because we are not there to ask, and the people experiencing and living the maternal deaths will know the best response of what is missing and how to fill that gap. Simple problems that cause maternal mortality can be no transportation to the hospital, lack of medical supplies, lack of education, or an inability to afford medications. Our goal is to fill the gap of the most prominent issue in Sierra Leone. No issue is the same for any country, and that's why we feel it is important to implement people going in to ask what the people of Sierra Leone need and how they want to see it come into their villages.
Our end goal is to hopefully make a big enough impact in Sierra Leone so we can attract other investors to help expand the program and do more research in other countries that have the same problems. No issue is the same for every country, and that's why we feel that it is important to implement.
We believe by simply going to speak to the people suffering in Sierra Leone, we will make strides of change. Rather than bringing in what we think they need, we can see the help they desire. By going to speak to people, we will learn how to implement better health standards into their culture and fill the information gap between simple deaths that can be prevented. No woman should be dying from a preventable death while bringing life into this world. With $50,000, we can find a solution to bring to investors to help us fund the needs of the people. We believe we will receive these investments because we will have had experience and knowledge from the people of Sierra Leone, helping us form a way to help them in a way they desire.